St. Louis Teens. I'm here today with Dr. Zinser, who is the head of infectious disease at SSM Health Center. And he was willing to answer a couple of questions about the coronavirus and the pandemic that has been the coronavirus. So hello, Dr. Zinser. How are you?
I'm good. How are you doing?
I'm great. I'm great. So to start off, I know that there has been a lot of media coverage about the coronavirus, and there have been a lot of people talking about it. So the very first question is, what should people's state of mind be about the coronavirus, and what precautionary measures should people be taking differently, if any, from just the regular seasonal flu?
At this point, for most people in the United States, in most every situation, they don't need to take any precautions any differently than they would take with the regular flu.
So, and then going off that, what measures could people be taking, if any, just sort of similar to the flu, just to prevent any sort of viral infection?
So, to prevent transmission of viruses, if you're around someone who's sick, you need to stay 6 feet away from them. The reason for that is that when a person coughs or sneezes, the water droplets go about 6 feet before they drop out of the air.
Okay.
If those droplets drop into your eye or your mouth or your nose, or if you inhale them before they drop out of the air, then you are coming in contact with that virus.
And so, essentially, the best precautionary measure would then to just avoid sort of any situation where you could be coming in contact in close proximity with other people who may be sick.
Right. The other important thing is frequent hand washing throughout the day.
And sort of going off that, I think that there are some coronavirus cases within the United States, and there are various schools around the country that have actually been shutting down. And is this the correct decision to make? And if so, should schools be shutting down even before there are any direct coronavirus cases within staff or students at the school?
At this point, schools should not be shutting down unless the Department of Health communicates with them to do so. But again, in most places in the United States, there is not a significant risk of coronavirus at this time.
And sort of going off that, while the risks, so it's been talked about a lot in the media, have a higher mortality rate and a higher infectious rate. There are still more sort of flu cases that have been causing more deaths. So, in your opinion, what is the sort of cause of this? Is this sort of overhype, or is this sort of over media coverage of this, or what is the cause of a lot more coverage of this specific viral infection?
The 24-hour news cycle media is overhyping it. However, it is an important issue that preparation of an outbreak.
Yeah, and I think that the United. What are your thoughts on maybe having some sort of limiting travel within the United States itself domestically as well? I think that with the fact that especially easy.
That's true, although at this point, there aren't enough people with the coronavirus to give a good rationale for limiting travel in the United States, other than to places where they are having known outbreaks. This this may change. One of the problems with the U.S. response has been the very slow deployment of testing kits.
Yeah.
And we don't actually know the extent of the coronavirus in the United States at this point,
Right.
because people have not been tested who should have been tested by this point.
Yeah. And I think, sort of going off that, I know that, the president has pledged $8.3 billion to actually, stopping the spread of the coronavirus. So is this enough? And if not, what other measures could the United States be taking in order to further prevent the spreading of the coronavirus and help patients who already have it?
At this point, this is enough. The CDC and public health agencies have plans for how to spend this money. Providing them with money that they don't have plans on how to utilize wouldn't be helpful. However, they may need more funding in the near future.
Okay. And I think that a large portion of people who are within school have spring break actually coming up. And, one of the large concerns after talking to various students at my school and other schools was, there are various students who travel during spring break. And, besides just avoiding places where there are already outbreaks to be known, should students be worried about traveling, whether it's, domestically within the United States or internationally?
Not domestically within the United States. We understand the concern,
Right.
but the risk is so low that by limiting needed travel,
Yeah.
the benefit probably isn't. The benefit of not traveling probably doesn't outweigh the
Right.
risk.
So I think would you agree that in summary, you should be the measures you should be taking to prevent the coronavirus for yourself personally would be just the regular measures you take to prevent the flu, staying away from close proximity with other people who may have any sort of viral infection, and that, that you shouldn't be limiting travel domestically within the United States. It's, compacted to where there are already outbreaks.
Correct.
All right. Well, that's all the questions we had for you today, Dr. Zinser. Thank you so much for your time, and have a nice day.
Thanks. I've enjoyed it. You have a good day.
All right. Thank you.